Hello, welcome to Healthy Homes for Home Health Care Workers. Today we're going to be doing video 8, Reducing Asthma Triggers. This is brought to you by the Indiana Healthy Homes Alliance and Improving Kids Environment, also known as IKE. My name is Dan Fries. I'm a team leader with the Marion County Public Health Department. So what is a healthy home? A healthy home is a home that is designed, built, renovated, maintained, and supports good occupant health. Today's video, we're talking about asthma and asthma triggers in the home. And asthma is a major symptom of a home that is not maintained or kept healthy. So a healthy home really helps to prevent and minimize asthma in one's life. So some of the objectives that we're going to be looking at today is to understand what is asthma, what causes and some of the symptoms of an asthma attack, to understand and identify common asthma triggers in the home, and to look at some possible solutions or resources to avoid exposure to those asthma triggers that may be found in the home. So what is asthma? Asthma is a chronic inflammation of the bronchial tubes, so your airways, and which can be cause swelling or narrowing of those airways. So it's going to cause difficulty in breathing, and it's irreversible, and it can cause scar tissue in the lung. So here's some illustrations of a normal airway, someone that has an asthmatic airway, and then you can see the airway actually during the attack, and you can see the restriction in those airways and how the wall can become inflamed and make it more difficult to breathe. I'm sure some of you have done this test or gone through this before, but one of the ways that you can experience what someone may feel like when they're going through an asthma attack is to take a coffee straw and use that to try to breathe, and kind of gives you that appreciation of the lack of air flow coming in and out of your lungs with an asthma attack. So some of the early warning signs of an asthma attack can be coughing, especially at night, having some trouble sleeping, loss of breath, and then maybe feeling cranky, and then having lower PEF numbers from the peak flow meter. And then some of the symptoms you're going to see actually during an asthma attack, you can have short, shallow breathing, along with trying to breathe a little bit quicker, a wheezing sound maybe, cough that won't go away, and maybe a tightness or squeezing feeling in your chest. So when someone's going through an asthma attack, they can start to feel a little bit more panicky because they are having difficulty breathing. You may hear wheezing, both breathing in and out. They may have the inability to stop coughing. And you may see signs of them maybe turning pale, sweating. So when we're looking at the home, what are some of the asthma triggers that we may find in our home? So some of the triggers can be allergens, and some of those can be dust mites. And dust mites are going to be found on your bed or on your upholstered furniture, so couches, chairs. We can have pet dander, so from your dogs and cats and other animals. Your cockroaches, and that's going to be the bug body parts, and then also its frass or its poop. And then also mold and pollen. So you can have mold that are on moisture surfaces and pollen that can come in, and the mold that is going to come in from the outside as well. And then we can have irritants in the home. So we're talking about tobacco smoke. You can have odors, air pollution, and then also cold weather is going to affect someone with asthma. So when we're talking about dust mites, we're talking about their casting and dropping. So again, their shedded body parts or skin and their poop. Again, we're going to find this in the bedding or on the mattress. It can be on the pillow as well. And then again, upholstered furniture, carpeting. And then when we're talking about children, one of the sources can be stuffed animals as well. So what are some of the things we can do to eliminate or reduce this is to put encasements on our mattresses and pillows, and so those are going to be the encasements for allergies. We're going to wash our bedding frequently, and when we do wash it, we're going to wash it in hot water. We want to make sure that we're also vacuuming frequently, and that's our carpet and our furniture. And if we can, we want to use a vacuum that has a HEPA filter. And then another solution is for the furniture. If we can, a slipcover would work really well because then we can wash that frequently and help reduce any pet dander or the dust mites from being trapped into the furniture. And then with the stuffed animals, we want to, one, if we have to have them, reduce the number that we have, and the ones that we do keep, we want to be able to wash those. And so that if we have those, then we can wash those regularly. And we can then also use a dehumidifier in the home. And a dehumidifier in the home is going to help with quite a few asthma triggers. So they may be a tool for someone that has asthma to keep in their home. Cockroaches, like I said earlier, it's their castings, so body parts, secretions, and their droppings. I don't know if you've ever come across cockroaches, but their droppings are little black spots, and you can, depending on the number in the home, pretty obvious to see, and typically those are going to be in your kitchens and maybe possibly bathrooms because of the moisture, but on the walls and maybe around outlet fixtures, things like that would be spots to kind of look and see, and if you see that, then you kind of know you may be dealing with roaches in that room. Also looking for dead or alive roaches in a room can be an obvious sign that you are dealing with the bug. And then also in the middle there's a picture there of their egg casing. And they typically, the female will carry that on them for quite a while. So just a little reference point, if you see a roach, it's not always a good idea to step on them because you could step on a female with that and then you have eggs on your shoe and you could track that to your home and get it that way. So what do we do if we have roaches in the home? We want to make sure that the house is clean. So we want to make sure that garbage, food is not left out. Our garbage can has a lid on it. Pet food is stored properly in maybe a plastic container. We don't have any maybe excess water sitting out in the home. We want to monitor, so you can put traps down to see if there's how big of a population they are, or if we're treating for it, that the population is going down. We want to make sure that when we're treating, we're not using a spray pesticide. We want to try to use baits, gels, or traps. That way we're reducing any asthma triggers in the home. You can also use boric acid, but you want to make sure that you read the label and you're doing it properly. You shouldn't see powder around the baseboards or on surfaces. It's, a fine spray of that, so it's a fine dust. And then also, if we know that we have roaches, then we want to make sure that we find out where they're coming in and out, and we can seal those access points. So looking under cabinets or looking for holes in the walls, things like that. Another pest that kind of runs along the same lines of the roaches, we're talking about mice. So again, they're kind of looking for the same things in the home. So they're looking for water, they're looking for shelter, they're looking for food. So if we're keeping the home clean, keeping our garbage sealed, keeping our food put away, then we're going to reduce the chances that we will have mice in the home. Some of the triggers that mice have are their hair and skin, then also their urine and saliva. So what we look for in a home for if they have mice is you're going to look for droppings. Also, you're going to look for damage from their chewing, and so that could be on boxes, so cardboard boxes or food boxes. So maybe, in your food pantry, you notice that there's a little hole in your cereal box or your rice box or something along those lines. Also, you can look for marks along your baseboard. So if you have a light colored baseboard and you notice it's starting to get a little smudge on it or turning a little bit darker, that may be a track where they're running back and forth. So they're rubbing up on it and kind of leaving their stain. And then you can use a black light and see where the urine might be. And again, we're going to want to make sure that we keep everything clean, fix any holes, reduce any moisture in the home. So if there's a leak, fix that. And again, keep food put away. And then we're going to use our glue traps or snap traps, or if you need or like to, you can use a live trap, which can be caught. If you do that, then you're going to want to take the mouse further away from your home so you don't have the chances of them coming back. But we don't want to use open box of poison or rat poison or mouse poison in the home. Mold and mold spores are a trigger in the home, and mold's one of those where it depends on the person. Some people are affected by a very little amount of mold in the home. Some people can be in a home that has a lot more. So if you can find or smell or see mold, then you need to try to eliminate it and remove it as soon as possible. Obviously, there's different types of mold, and you can see different signs of where mold are, but once you start seeing mold, you want to make sure that, one, you're finding the water source. Mold needs water and food to grow, so the water is your leak or a surface that got wet, and then the food's going to be the dust that settles on that surface, and then it can grow on that. Typically, you're going to find your mold in areas that can have excess moisture, so kitchens, and where kitchen has lots of water sources in there, but also you're doing cooking in there, and if it's not vented out properly, then you can have moisture that builds up on the walls or on surfaces, and then that can have mold growth. That's the same with your bathroom. So you want to make sure your vent's working correctly in the bathroom, but then also keep a close eye on sweating of your pipes in the bathroom or your toilet. So you could really see that maybe in the summertime, where you have a lot warmer air temperature and the toilet's filled with cold water. So when those two come together, you can have sweating. And then another area to look is going to be in your basement, or even in your attic if you have that, for possible leaks in your roof. So if you do have a leak, what do we want to do, or what do we do? So first of all, you want to fix that as soon as possible. If if you don't have the means to do it, then you want to contact someone to come out and do it. You don't always have to do the first quote, but make sure that whoever's coming out is going to do it correctly and for the right price. You want to make sure that if items are wet, that you get them to be completely dry before doing any work on them, if it's something that you're not removing. So if if you have a wall that's wet, you completely dry it out if you're not going to be cutting out and discarding that material. Make sure when cooking or bathing that you're using your exhaust fan, and if you don't have an exhaust fan, if there's a window in that room, that the window is open. A good train of thought, if you can, with an exhaust fan, if you can leave it running for 15 to 30 minutes after you shower, that'll help remove any excess moisture that's in the air. We're going to make sure that anything that has a vent is vented outside. So your dryer, also your water heater or your furnace, if you have a gas stove, those things are all vented outside. And then again, if something does get wet and it does start to show mold growth, that we get rid of that material. So carpets, ceiling tiles, drywall, and if it's a surface that can be cleaned, that we clean it correctly and properly, and then make sure that it's dried completely before we do any repainting or any extra work on that surface. Secondhand smoke is a asthma trigger. So if you're present in the home, you can see when someone's smoking. If you're not, some of the signs that you could see would be the house has the smell of tobacco smoke. You may see cigarettes or ashtrays in the home, but you also may see like e-cigarettes, cigars, etc. In the home. If someone does smoke in the home, we really encourage them to not smoke in the home. So have them smoke outside. You can have no smoking signs posted. You can have, ask them to have a designated smoke area outside, preferably a little bit further away from the home. And if they do go outside and smoke, have a smoking jacket, which they can then remove when they're coming into the home, and then preferably keep that outside as well, because you can still have off gas from the jacket, or particularly if they don't wear a jacket, their clothes, when they come inside, they can off gas as well, and then you're still having that secondhand smoke in the home. Another trigger is nitrogen dioxide, which is produced by gas and wood burning appliances. So we want to make sure that when we have these are properly vented, and they're vented outside. We're going to be looking for, if someone has a gas stove or a fireplace, they may have a kerosene or gas space heater. So again, if you come across these in the home, we want to make sure that these are all vented to the outside and properly maintained. If you're seeing like burn marks on the machine or near where the vents are, then they're not being properly vented, and that means that you're having the nitrogen dioxide coming into the home. So not a good thing. So we want to make sure that furnaces, chimneys, those are looked at, and maybe once a year or once every other year, to make sure that everything's working properly. Another asthma trigger are warm-blooded pets, and those triggers are going to be their dander, their urine, and saliva. So obviously, when you go in the home, you're going to be looking for one. Okay, do they have a dog or a cat? But then also, that the pet may not be around, because you may be going there and they may be aware that they may not have it. So you may look for pet food, a leash, a litter box, pet toys. Other signs of a pet could be scratch marks on the door or wall, things like that. If someone does have a pet and they don't want to get rid of it, we want to try to eliminate the pets from being on the bed. So you don't want the pets to sleep with the person that has the asthma. If you really could eliminate them from even being in the bedroom would work, but if they really want the pet in their room, then have that pet have its own bed. And then we're going to want to make sure that we're washing the linens and your couch covers, things like that, frequently in warm water. And then also we're going to make sure that we're vacuuming the carpet, the rugs, and furniture frequently as well. And again, if you can, have one that has a HEPA filter. Another asthma trigger is strong odors. Some people don't necessarily think of this as much, but using your bleach or harsh chemicals to eliminate the mold or mildew that you see can be just as bad as that mold or mildew that you have. And then also having your sprays in there or your candles in the home can be triggers as well. So if you can, eliminate those sprays and candles in your home. Try to use green cleaning if possible, so less harsh chemicals. That way you can cut down or manage the odor and the strong smells. You can see on the side some of the examples using small amounts of essential oils and baking soda and water. And there's many different references that you can go to find green cleaning products or ways to make your green cleaning products in the home. And then another trigger that we're looking at is poor indoor air quality. So looking at, again, odors, dust, especially excessive dust. And then if you're in your home, looking at the homes that the windows that don't open, so you're not being able to get fresh air in and out of the home. So what do we do with dust or poor air quality in the home? We want to make sure that we're maintaining our furnace, so making sure that the filter is working correctly, that we're changing it routinely, at least quarterly. And also you want to make sure that the furnace is the filter for the furnace is the right filter. So you may be using a very low quality filter that's not trapping anything or as much dust as needed. But also you have to be cautious of using one that's too strong or too thick for your furnace and may make it work too hard. So you kind of have to find that balance between what is the right filter for your furnace. Again, when we're talking about the furnace, that we're making sure that the heating system and cooling system are working correctly, that everything's vented out properly. And we want to make sure, again, that the windows can open and close. And if we're using a window air conditioner, that it's vented properly. And you want to make sure that the vent control is open so that you're actually getting in fresh air from the outside. Thank you for listening. Here are some resources below that you can look at that have more information on asthma triggers in your home. And I encourage you to look at that. Thank you.